President Biden's COVID symptoms are almost completely resolved. That's according to the latest update from the White House physician. The president today saying he's so close, referring to his last day of isolation with COVID. The White House doctor saying the president has a normal temperature and pulse and his lungs are clear. President Biden says overall he is feeling great. So joining us live now to talk about a number of topics, White House Chief Medical Advisor, Dr. Anthony Fauci. Dr. Fauci, so nice to talk with you again.
Thank you for having me. Good to be with you.
So we want to start with President Biden's health. We know he is 79, but he is fully vaccinated. He just finished taking Paxlovid. Is this the treatment all Americans should be receiving, or is he maybe receiving special treatment because he's the president?
No, he's not receiving special treatment because he's president. He's vaccinated and he's doubly boosted. But given his age, that he is in the category in which Paxlovid is recommended. Paxlovid is recommended for individuals either who are over a certain age, and he is over 60, 65 years old. In fact, even people over 50, you would consider giving Paxlovid. But also, it's a situation where if people have underlying conditions, he's a relatively healthy person. He's a pretty healthy person, quite healthy, as a matter of fact. But given his age, it would be absolutely indicated, because when you look at the possibility of someone getting a severe result from COVID infection, leading to hospitalizations and or unfortunately death, Paxlovid gives you a very high degree of protection, up to 89 to 90%, in protecting you from advancing to hospitalization. He was not treated specially because he was president. He would have been treated that way even if he were not president of the United States.
All right. Well, doctor, do we know anything more about where he contracted the virus? You know, the White House really hasn't said at this point.
No, we don't know. And that's often the case when you have someone whose job and his job is to be out there interacting with the American public. We don't know precisely when or how he got infected. And that, again, is really not surprising. I got infected about a month or so ago. And I don't know. I have suspicion of when I was in a particular setting where there were not a lot of them not masked. And I, for a period of time, didn't have a mask on. But I don't know definitively for sure if that's where I got infected. It would be very unusual for people to absolutely pinpoint when they're really very close to someone who they know is infected. But when you're in a crowd of people who you don't know who is or is not infected in that group, it's very difficult to tell precisely when you were infected.
Yeah, certainly difficult to make that determination. All right, we're talking about the current president. Let's switch to the former president now, Dr. Fauci. About an hour ago, former President Donald Trump wrapping up a speech in D.C. We've been talking about it here on Rush Hour. He talked about the start of the pandemic, how he handled it, and he also spoke about you. Let's listen.
They said there's a terrible thing happening in China. There are a lot of dead people laying all over the streets. There's something going on. Shortly thereafter, I closed it up long before Nancy Pelosi wanted it, or any of these people, including Fauci. I used to listen to Fauci, and whatever he said, I did the opposite. I came out very good.
All right, so that's coming from former President Trump just about an hour ago. What's your reaction, Dr. Fauci?
I don't have any comment to that. None. No comment at all.
No comment.
The record speaks for itself.
All right, well,
Done.
Former President Trump, obviously a Republican. We want to talk about other Republicans. Some Republicans in Congress, including Senator Rand Paul, say they do plan to subpoena your records and call you to testify if they take control after the midterms. Do you have reaction to that, and would you comply?
No, of course. I've testified before the Congress a little bit more than 250 times over the last 38 years. I have no trouble testifying. When they say they're going to investigate everything about me, all the records are out there. I mean, every one of my emails practically have been FOIA'd for the Freedom of Information Act. And if they're going to investigate me, I'd like to ask the question, investigate me for what? For telling people to get vaccinated? For telling people to wear a mask? For telling people to abide by common sense, good public health practices? If they want to investigate me for that, go ahead.
All right. Well, you heard it here. Dr. Fauci, let's switch from coronavirus. Let's talk about monkeypox now. Of course, you are the president's chief medical advisor. Is the administration going to name a monkeypox coordinator?
I'm not sure. That certainly is under consideration. I can't tell you for sure whether that's going to happen. I mean, obviously, with or without a coordinator, we are taking monkeypox very seriously. It's an evolving situation. Right now, we have in the United States close to 3,500 cases. It's now, I would say, maybe like 19,000 cases outside of the endemic countries in Central and West Africa. So it's something that you want to take very seriously. If we have a coordinator, I mean, I'm sure that would be someone who would try to integrate and coordinate across the government, because there are many agencies involved in this. So I don't know for sure if we're going to have one, but if we do, it certainly would be value-added.
Well, Dr. Fauci, mentioning a coordinator there, let's talk about the COVID-19 response coordinator. Just days ago, said that the health department is considering declaring monkeypox a public health emergency. Doctor, what would it take for that to happen?
Well, the Secretary of HHS would have to make a determination that this is a public health emergency. And right now, that's under active consideration by Secretary Becerra. I can't tell you what his decision is going to be, but the determination is made by the Secretary of HHS.
All right. And you've been a physician for decades at this point, so we want your opinion here. The World Health Organization split, actually, on its declaration over the weekend. What is your opinion? Was the WHO's declaration prudent, or do you think it was maybe potentially done too soon?
No, I'm not going to outguess the WHO. I'm really sorry. I'd like to have you have a soundbite here and there, but I'm not going to give it to you. That they made their decision, and I support their decision.
Fair enough, Doctor. Do you think that the U.S. is prepared for this, or should we be doing more?
You always should be doing more when you're in a situation where you have an evolving situation. But if you look at what we have right now, we know what the pathogen is. We have tests for it. We started off with 6,000 per week. We now have over 80,000 per week available. There have been about 325,000 vaccines distributed. There will be another 800,000 of these that are going to be distributed, hopefully within the next week or two. And we have Paxlovid, an antiviral drug, which we need to do a little better about getting the red tape around it removed so that you can get more easy access to it. But there is antiviral drug that is available. So there are a lot of things that are being done that are being done very well.
Well, speaking of that, I want to stay focused on the monkeypox vaccine there. I know you said that there'll be thousands more coming. Would you encourage everyone to be vaccinated, once there is enough supply for everyone?
I don't think that that would be necessary. About 99% of the cases are among men who have sex with men. What I would recommend that in the sexual network of men who have sex with men, if you have multiple sexual partners and you are at risk for this, then I clearly would recommend that you get a vaccine to prevent you from getting infected. But with regard to the general population, the risk at this point to the general population is very low, given the epidemiology of what we're seeing. We know that it can go beyond.
Right. Yeah, and I want to ask you about that because we know right now it is focused on the men who have sex with men, but anyone is susceptible to this, correct? If you have that close contact?
Well, anyone who has close skin-to-skin contact with someone who's actively infected does, but you've got to follow the epidemiology. And first of all, there's not enough of the vaccine of the Jynneos right now to vaccinate the entire population. The original development of vaccines for smallpox, we have 100 million doses of what's called ACAM 2000. One of the problems with that is that in a certain percentage of people, there can be adverse events, more so than with the Jynneos, which is clearly less likely to give an adverse event. But there's a limited supply of that right now. We are certainly going to get more of that right now. But the original stockpiling was for a smallpox outbreak in which anyone could be susceptible. It appears that with this outbreak, at least up to now, approximately 99% are among men who have sex with men. You need to keep an open mind and be prepared for the possibility that it will go beyond the population of men who have sex with men. But right now, it appears to be pretty well confined to that, with an occasional offshoot. For example, there's a report of 2 children having gotten infected. We don't know the exact epidemiology of that. The CDC is working on that, and when they find that out, they'll let us know.
Well, speaking of being prepared and obviously keeping an open mind, we are, in year 3 of this pandemic. There's been a lot of varied messaging, over the years. So what is your message now to people, who after COVID maybe don't trust the CDC or the FDA, or maybe have lost some of their trust in those organizations? So, whether it's monkeypox or something else down the line, what do you say to Americans?
Well, I would say that you should have faith. I mean, the CDC is an organization that is really trying their very best and doing a reasonably good job of protecting the American people from emerging and re-emerging infectious diseases. So look at the data. The CDC says get vaccinated. I say get vaccinated. If you look at the difference between people who are vaccinated versus people who decided not to get vaccinated, and look at hospitalizations and deaths, it's overwhelming that it is weighted towards people who are not vaccinated. So in that respect, whether or not you show those who has trust in who and who's the most popular or not, look at the data.
Right.
And getting back to what you said, it's an important point about certain elements making this political and saying they're going to investigate this, investigate that. If you look at what I have said over the last 2.5 years, everything has been to encourage people in the United States to implement and practice good public health practices, getting vaccinated, getting boosted, being prudent, wearing a mask when you're in a congregate indoor setting. There's nothing wrong with that except that it is good public health practices. So when you ask me that question of someone is going to investigate me for that, it's a bit puzzling why you would want to investigate someone for trying to protect the health of the American public.
Well, Dr. Fauci, I will say, you certainly over the years have not dodged the questions. I know that you're always willing to talk to us. So final thing before we let you go, I asked you this the last time I spoke with you a couple months ago. You do say you have said you plan to stay through President Biden's first term. Is that still the plan?
No, I said I don't expect to be in the federal government in January of 2025. So I will step down somewhere between now and then. I didn't say how long I would stay because I haven't made up my mind. I just said I would not stay beyond the end of the first term. So that's the outer limit.
All right.
If you go back and look at my words, the Politico distorted it a little bit. I said I would not stay beyond.
Yes, okay. It's all about semantics. All right. Dr. Anthony Fauci, we thank you so much for your time today.
Thank you for having me. It's always good to be with you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.